这舌头哈，稍微轻微的薄黄，一点点干。Okay, could you curl up like this? OK， 好，舌下微淤哈，有一点轻微淤阻的现象，尤其是它右边的舌头的淤的现象比左边多一点点。Okay, thank you. Could you let me know you come to see me today, the major purpose?
About a month ago, I had a cramping in my bladder area in the morning when I got up to urinate.
Morning time?
Morning time.
The weather is cold or hot? Or just normal?
I don't remember.
Uh-huh.
It was warm.
It's warm.
Yeah.
Okay.
But morning was cooler.
Oh, yeah.
And I had a pain here that was kind of like a radiating pain and a cramp at the same time.
Mm-hmm. So also have a radiation pain?
A little bit. It was kind of, little bit of pain and cramp together.
Is it will referral down to your leg or not? Or
No,
only on the
just
local
right
area?
here. And I knew right above my pelvic bone it was my bladder. And because of past history with the narrow urethra, I thought this was different. And within about 12 to 24 hours, I started to develop a fever. And so I knew something was...
So the fever, how long the fever last?
Maybe 2 days, 1 or 2 days before I went to go see a doctor. And he prescribed some antibiotics to help reduce the fever.
But have you found any bacteria from your
urination? I had a urinalysis done and it came back negative.
So everything negative?
Everything was negative. I don't think I had blood taken, but he suspected that it was an inflamed prostate or prostatitis. He did not do a prostate exam. But I have a regular prostate exam done on my
Have they found
physical.
any enlargement or the shape change?
Again, about 6 months ago in my last physical, that's the last time I had the prostate checked. 1 month ago when I had this problem, they did not check the prostate. And so 6 months ago, everything was normal.
Okay, but this time have a check the prostate?
They did not check.
Not.
No,
Okay.
no.
So they do the check is from the anus, right?
Correct.
Okay.
Yeah.
But they don't find anything?
Correct.
Everything is normal?
Everything's normal, yeah.
Okay. And can you recall what anything caused the urethra to become narrow?
This going back 25 years ago when I first discovered some resistance when I pee. A urologist went in and scoped the urethra and found a narrowing or a stricture in the urethra that was scar tissue. So he suspected that some injury as a child caused the stricture or the scar tissue. I don't know what it was. Nothing comes to mind.
But you cannot recall anything like an injury? Or
I do recall when I was very, very young, I came running out of the bathtub after having a bath when I was maybe 2 or 3 years old, and I got bit by a dog in this area. But I was so young, I don't remember. That's aside from, normal things that boys, climbing fences, falling down, bicycles, basketballs, soccer balls, there was nothing specific to this area that I think would have caused that scar tissue, except the dog.
But can you remember the first time you suffered the pain or the urination have some difficult?
Yeah, it was when I was in college. In university. Yeah.
So the first time.
The first time, and I noticed it was a little bit harder, slower. And so if me and a friend went to the bathroom together, I would finish later. Just no pain.
No pain.
And then a little bit of discomfort, like I had to push a little bit more.
Have any like a burn sensation?
Yeah, a little bit.
A little bit.
A little bit. And I've
or just feel the urgent sensation.
Not really urgent sensation, but since that time, I've noticed that it takes more effort. I have to push, and it's more difficult for me to completely empty my bladder. So maybe I have to go, in 3 hours, maybe you go to the bathroom one time, I may have to go twice.
Okay. So how about today? You also feel the pain or not?
No pain.
Today, feel no pain?
Today, no pain. But I do notice we were in the car for 2 hours driving here, and I had to go to the bathroom. And so I waited until we got to your office, and I grabbed the key and I went to the bathroom. And I had a bowel movement, which I think causes a little bit of pressure. And maybe when I have a bowel movement, it makes me feel like I need to pee more.
At the same time. So
Same time.
every time when you want have a sensation to go to poo-poo, you also have a pee-pee sensation.
Yes.
Okay. At the same time.
Yeah.
Okay. So.
But no pain, like you said. It just was. It was maybe this morning a little bit of pain, but that's just because I had to go to the bathroom. And once I went, fine.
So mostly you only before you pee, you have the distension sensation, or feel something stuck inside.
If I hold it in the car for 2 hours, yes. But normally I don't hold it.
Okay. So in the daytime, how about the frequency?
Well,
Every hour or every 2 hours, or how many times per day in the daytime?
Good question. I think if I have coffee or tea in the morning, or lots of liquid in the morning, it's sometimes once every 30 minutes. That's if I have a lot of liquid going through my body.
So every 30 minutes you need to go to bathroom.
Right. But I'd say maybe for 2 hours it's like that. But on average, in one day, I'd say 4 or 5 times.
Yeah, it's pretty normal.
If I have a lot to drink, maybe 7 or 8 times.
7 or 8 times. Okay. But from the frequency, suppose it's normal. Yeah.
Okay.
Okay, so I think there's a very, very special case. I think it's really from the urethra that become the narrow. So even sometimes if you hold too long, you cannot go to pee. They will cause the pressure inside. Especially when you do pee, you need to the bladder needs to do the extra work to push out. Yeah, so that's why. Okay. Well, right now we will do some abdominal check for you.
Okay.
Okay. So I will do the popping and also the palpation. If you feel the tender, let me know.
Okay.
Okay. Thank you. 没有鼓音哈，没有鼓音。哦，这个乐光角很宽。OK， 这样 we mentioned about the rib cage open. If the open wider, that means you are always have the public sinking. That's good. Mostly you feel the happy and another so sadness. So that's good. That's good for everybody. Okay. A little bit pain or not? The tender right there. If I push like that and compare this area.
A little bit.
A
But
little
not,
bit.
Yeah, I was going to ask, what is that? What is there?
There's the stomach area.
Yeah.
Yeah. So that means your digest function is not 100% good. But it's okay. It's not a big issue right there.
Yeah, there was no pain, but I could tell you were pressing on something.
Yeah.
It's like,
okay.
what is that?
Especially if you compare
Yeah.
beside the area, you feel nothing. But this area, you feel a little bit pressure. Right there.
Yeah.
Yeah.
Pressure. Yeah. No pain, but pressure.
Feel a little bit tender, right?
A little bit
A little
of pressure. Yeah.
pressure. Okay.
And what is that?
I will let you know later.
Okay.
Okay, right now we'll go into the key point area. Okay, for example, this area you feel some tender, but this area you feel nothing.
Right.
Right, okay. this area, that means the circulation not very well, especially for this area. So a little bit tender, right?
Yeah.
对，这是夜尿点跟频尿点哈，就在这个耻骨联合上方 ，the pubic bone just above the pubic bone.
Yeah, and you were in an area up here.
So when I push, the sensation will up to here.
No. Before, when you were
Before.
up here, there's a
Oh,
little
okay.
bit of, yeah.
OK. 哦，它还有一个正中蕊。Could you just lower down? Yeah, a little bit. OK. Yeah, it's enough. Thank you.
Yeah.
注意看这边有一个凹痕哈，这个地方这个凹痕也表示下焦就比较弱一点。So the first point you feel the tender, right? Okay. So the second point I think you will find right there. Okay.
Yeah.
Just
that's
like
a little pain.
just like you have the chopstick inside.
Yeah.
You can feel, right? Good.
And that has some.
这边哈就是凹陷，这个我们可以说它是少腹不仁，所以这方这是确实有肾虚的现象，但是这边呢有一些这种粘连，又是有瘀的现象。So you have the 3 point you feel the pain or tender.
Yeah.
First one,
And
the
then,
second one.
yeah.
Suppose it right
Yeah.
there. Okay. But if compare the median side and also the both side, the both side more tender or the median area more tender.
Sides.
Compare side
Yeah,
more tender.
yeah.
Okay. 它的频尿的依然是最主要的重点。Okay. That's not only for the diagnosis. That's also for the treatment. You can do the massage or you can do for yourself. Just do the massage like that.
or both.
Both.
Both, yeah.
Both.
Yeah.
Both. Yeah. Especially before you sleep, you can do that. Or after you wake up, you also can do that. But make sure before you do the massage, go to pee and poo-poo
Okay.
to
Empty.
clean out everything.
Yeah.
Empty, yeah.
Okay.
And also the processing, when you do that, if you have the sensation want to go to pee, just go to pee.
Yeah.
Yeah, don't hold it.
Okay.
It's very important. You cannot hold the pee.
Yeah.
Yeah.
I usually don't, but
Okay.
we were late.
Okay. I remember just 10 minutes ago, you told me, because when I describe, you need to do the massage, the acupoint 1, 2, 3, and also the other point is we call it the Hui-Yin point. The Hui-Yin point is between the anus and the bottom of the penis. Very interesting. You told me when after you pee, you need to push the Hui-Yin point, right?
So,
Then-
I'm sorry.
Yeah, you just described.
When I finish peeing, I notice that sometimes there is a little bit of urine left inside their urethra. And so, out of habit, I've pushed on that point it's between my scrotum and my anus underneath, basically your crotch. And when I push on that, I notice that a few more drops come out.
Then you feel the completed.
Yeah.
Okay.
Yeah.
Okay. Good.
I notice when I don't do that, that sometimes it gets in my my underwear, but it's very little. It just helps empty the last little bit, and that I don't know if that's because of the stricture or if that's normal.
I only can say you are too smart.
Well, I
You
doubt
know the
that,
Chinese secret.
but that's the pressure point.
Yeah, the pressure point,
Okay.
and also it's a very, very important point, especially in Chinese herbal medicine. The meridian is from the Zen point. This point is very important for the reproductive system, and also it's good for help you to pee come out. And also, I think it just from your nature, from your nature, you know how to help yourself. This is survival. So you just do the right things. But maybe you only know you can help you to complete the urination.
Right.
But if you can do it every day and a more frequency, then is good treatment for you, for yourself.
Okay.
So the easy way is that the treatment point you need to do the frequency urination point
Yeah.
and the median point.
Yeah.
The 3 points just like a smile area just above the pubic bone.
Mm-hmm.
Yeah. And so you do the 3 point and also the 会阴 point.
Mm-hmm. So I
Every
do
night.
the, what'd you call it, the weighing point?
会阴 point, yeah. Just
I do
in front.
that every time I urinate. Every time.
Yeah, if you could.
And you're saying do these 3 points right before I go to bed or
Yeah.
in the morning or both?
If you could, the best way is whenever you have time, you do that.
Okay.
And also, you can also ask your wife to do the massage for this area.
Okay.
Yeah, and also the spatial massage. You also can massage the penis area, and you try to find just that very little to massage and twist, and try to feel which section or which point
Is
you
narrow.
feel the tender.
Okay.
That mostly the tender point is a narrow area. So if you do the massage, also can try to dissolve the adhesion, and also try to remove the scar tissue. So it's good. It's good for you.
Okay.
Okay. So how about your bowel movement every day? How many times?
On average, 2 times, I would say.
2 times.
Yeah.
Is soft or hard?
Over the past 3 or 4 weeks, it's been good, I would say. Maybe 2-3 days ago, it got soft. But then just before my appointment, it was more firm.
Okay.
Does that answer your question?
Yeah, this is my work question.
Okay.
Yeah. How about your appetite?
Pretty good.
Pretty good.
Yeah.
How about the sleeping
I'm
quality?
hungry now. The quality of sleep?
Yeah. Do you need to wake up to pee-pee at the nighttime?
I'd say every night at least once.
At least once.
Yeah, sometimes twice, sometimes none.
Okay. In our treatment,
Yeah.
if I really can give you help, suppose we'll reduce the urination at the nighttime.
Okay.
Yeah. So right now, after I do the check,
Yeah.
and also in Chinese herbal medicine, you have the kidney function deficiency and your body condition a little bit cold and also yang deficiency. Then that means you need more energy to help yourself. So remember more ginger tea and also reduce anything cold. No ice cream, no ice water, no cold water, nothing cold. Okay. Do you like anything cold?
Ice cream,
Ice cream? Okay, good.
but not regularly.
Oh, okay. Sorry, you need to quit.
Quit ice cream.
To quit ice cream at least 3 months.
Okay.
Yeah. So when the summer season, you can enjoy a little bit, but not too much.
Yeah. Okay.
Okay. Thank you. And also right now we check the other area. Yeah, the same thing right there. You can feel it, right? I suppose you can feel the tender. 好，那这个东西都在胫骨骨缘边的地方，筋骨交接之处。我的脚有点冷啊。Yeah, and also I want to say thank you to you because you can offer your case study for everybody, and also I think this is a very good case study, and even the doctor or the patient can learn from you. So you are our teacher.
Thank you.
Thank you so much.
Yeah, you're very welcome. I hope it helps.
Thank you.